Hi there, and welcome to the channel. I'm Laura, and today we're going to talk about a topic that brings up a lot of curiosity, anxiety, and unfortunately, a lot of misinformation. What is the normal penis size? And even more importantly, how do you accurately measure both length and girth? With the rise in male genital cosmetic procedures, this question has become more and more common in doctors' offices, online forums, and social media. But before we go any further, I want to start by reassuring you with something that might actually surprise you. Around 95% of men who worry about the size of their penis are actually within the medically normal range. Yes, you heard that right. In most cases, we're not talking about a physical issue, but rather a distorted body image. A lot of men perceive their size as inadequate due to unrealistic comparisons, especially with what's portrayed in adult films or online, where exaggerated or even digitally altered bodies are often shown. What's also fascinating is that this concern is far more common among men than women. While about 55% of men report feeling anxious or dissatisfied about their penis size, only 5 to 10% of women say they consider it a very important factor in a partner. So take a deep breath. My goal here is to educate, inform, and most of all, put your mind at ease. In this video, I'll share real scientific data, explain how to properly measure both length and girth, go over the procedures that exist for enhancement and their risks. And we'll even look at a historical curiosity that might just shift the way you think about the topic entirely. Let's start by learning how penis size is measured correctly. Now, let's talk about how penis size is actually measured, because this part is essential for understanding what's considered normal. There are two main dimensions to consider: length and girth, which is the circumference or thickness of the shaft. How to measure length. Penis length can be measured either when erect or when flaccid and stretched, and both methods are used in scientific research. But the most consistent and clinically reliable method is the flaccid stretched length, which closely correlates with erect length. To measure correctly: 1. Use a ruler or measuring tape. 2. Place it at the pubic bone, right where the penis meets the body. You may need to gently press into the fat pad to reach the bone. 3. Stretch the penis out not forcefully, but firmly, while flaccid, and measure to the tip of the glans, the head. The same process applies when erect. Start at the pubic bone and measure to the tip, keeping the ruler on top, aligned with the shaft. It's important to avoid measuring from the skin or from underneath, as this adds extra length and leads to inaccurate numbers. How to measure girth, circumference. Girth is just as important as length and can vary significantly between individuals. To measure: 1. Take a soft measuring tape or even a piece of string. 2. Wrap it around the midshaft of the penis, neither too close to the base nor the tip. 3. Record the number where it meets. You can do this measurement both flaccid and erect for comparison, but in most studies, erect girth is the standard. Many men tend to overestimate or underestimate their size due to poor measurement methods or by comparing themselves in non-erect states to others in fully erect states, which creates unrealistic expectations. Coming up next, I'll walk you through what the actual scientific data tells us about averages, so you can see where the majority of men truly fall. Alright, now that we know how to measure penis size correctly, let's take a look at what the science actually says. There was a large-scale meta-analysis conducted with data from nearly 15,000 men worldwide. This kind of study combines data from many different research papers to produce reliable averages. Average length. When measured erect or flaccid and stretched, about 90 to 95% of men fall within the following range. Length, between 10 and 16 centimeters, that's roughly 4 to 6.3 inches. The global average length is around 13.2 centimeters, or just over 5 inches. So, if you fall somewhere in that range, you're completely normal. Now, on the extreme ends of the spectrum, there are medical definitions. A micropenis is defined as an erect or stretched length of less than 7.5 centimeters, or about 3 inches. A macropenis, which is very rare, is usually considered above 24 centimeters or over 9.5 inches. But remember, these cases are statistical outliers and represent only a tiny fraction of the population. Average girth, circumference. Girth varies as well, and again, the majority of men fall into a typical range. Flaccid, stretched girth between 8 and 10.5 centimeters. That's 3.1 to 4.1 inches, with an average of 9.5 centimeters or about 3.7 inches. Erect girth between 10 and 13 centimeters, about 3.9 to 5.1 inches, with an average of 11.5 centimeters or about 4.5 inches. So, when people talk about being average, these are the real numbers they're referring to. Unfortunately, many men compare themselves to unrealistic standards, especially those they see in adult films where actors are specifically selected for unusual size, and even then, angles and editing exaggerate the perception. The takeaway here is simple. If you're within these ranges, you're in the vast majority. And even if you're outside the curve, that doesn't define your health, desirability, or masculinity. Before we move on, I want to quickly share something important. If you're someone who's felt frustrated, maybe even embarrassed, about performance in the bedroom, or if you've noticed changes in stamina, sensitivity, or desire, you should know it's not your fault, and you're definitely not alone. There's actually a simple, 100% natural remedy that's been quietly helping over 63,000 men feel confident again, restoring firmness, drive, and that rock-solid strength without pills, injections, or risky gimmicks. It's a quick 7-second technique you can do at home, and it works by supporting what scientists are calling the manhood molecule, a key trigger for arousal, blood flow, and staying power. Just point your phone's camera at the QR code on the screen, or click the pinned comment below this video to watch the short presentation that explains exactly how it works. Now let's continue, because next, I'll walk you through the cosmetic procedures some men consider, what's actually safe, and what to avoid at all costs. Now let's talk about something that a growing number of men have been curious about: penile enhancement procedures. It's completely normal to wonder if there's a way to change or improve your size. But it's really important to separate medical facts from marketing hype and to fully understand the risks and limitations involved. Girth enhancement, increasing thickness. One of the more common cosmetic procedures today is aimed at increasing girth, and the most talked about method involves injecting hyaluronic acid. Hyaluronic acid is a substance naturally found in the body and is used in facial fillers as well. When injected along the shaft of the penis, it can increase girth by 2 to 3 centimeters temporarily. The effect lasts around 12 to 18 months, depending on the product and individual metabolism. It's considered safer than other substances and is absorbable by the body over time. However, not all injectable materials are safe. Some clinics offer non-absorbable fillers, such as PMMA, polymethyl methacrylate, or even industrial-grade silicone. These can cause severe complications, including chronic inflammation, hard lumps or nodules, deformation, irreversible damage to tissues. For that reason, these substances are not recommended by reputable medical organizations. Lengthening procedures. When it comes to increasing length, options are far more limited and riskier. 2 procedures sometimes offered are: 1. Liposuction of the pubic area. This removes fat around the base of the penis, making more of the shaft visible. It doesn't actually increase length, but can improve appearance. 2. Suspensory ligament release, a surgical procedure that cuts the ligament holding the penis close to the pubic bone. This can add 2 to 2.5 centimeters of visible length when flaccid, but it doesn't increase erect length. It may cause instability during intercourse. There's a risk of complications and scar tissue. Importantly, there are no permanent, approved methods for true penile lengthening endorsed by Brazil's Federal Council of Medicine or most international medical bodies. And finally, it's important to clarify that penile implants, which are sometimes seen online, are not meant for size enhancement. They're medical devices used in the treatment of erectile dysfunction and are only recommended in specific cases. Coming up in our final part, I'll share a historical perspective that might change the way you think about penis size and wrap up with a few final thoughts. To wrap things up, I want to leave you with a fascinating bit of history that might change the way you look at this whole topic. In ancient Greek culture, the ideal male body was actually portrayed with a smaller penis, and that was seen as a sign of wisdom, self-control, and rationality. In contrast, large penises were often associated with barbarism, lack of discipline, or even comedic exaggeration. Just look at sculptures of Greek gods and philosophers. You won't see oversized anatomy. And when large penises did appear in art, they were often part of caricatures or depictions of mythological figures like Priapus, who was literally a fertility god portrayed as grotesquely exaggerated. Why does that matter? Because it shows us that cultural ideas about masculinity and size change over time. What's considered ideal in one era can be the opposite in another. That means a lot of the anxiety people feel today is based more on social influence than biological truth. So, if you've ever felt insecure or pressured by what you see online, in media, or even from locker room talk, you're not alone. But hopefully, this video has helped put things into perspective. At the end of the day, penis size does not define your worth, your ability to please a partner, or your masculinity. What really matters is your confidence, your respect for others, and your health, both physical and emotional. If you found this content helpful, don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss more science-based, judgment-free content like this. Thank you so much for watching. I'm Laura, and I'll see you in the next video.